In the United States, a stroke occurs every 40 seconds, marking it as one of the leading causes of both death and long-term disability. Typically, when we think of strokes, signs like sudden numbness, confusion, or difficulty speaking come to mind. However, today we're delving into lesser-known yet equally critical indicators that could save lives. A stroke happens when the blood flow to a part of the brain is cut off. Without oxygen, brain cells begin dying within minutes, which makes recognizing any sign, common or uncommon, absolutely vital for immediate treatment. Let's explore some of these unusual signs. One of the lesser-known symptoms is sudden severe headache with no known cause. Unlike typical headaches, these are abrupt and severe. Next, unexpected trouble with vision in one or both eyes, ranging from blurriness to a complete, temporary loss of sight, can also signify a stroke. Another uncommon sign is sudden dizziness or an unexplained loss of balance, which could easily be mistaken for general fatigue or lightheadedness. More subtle yet significant symptoms include sudden nausea or vomiting, which is especially noteworthy when not linked to other common illnesses. A brief loss of consciousness or fainting could also be a stroke's warning, often overlooked because it can be attributed to other less severe health issues. Additionally, relentless hiccups might sound trivial, but in fact can be a unique sign of a stroke, particularly in women. Understanding these uncommon signs is crucial. They're often overlooked because they can be mistakenly associated with less serious health problems. If you or someone else exhibits any of these symptoms, it's imperative to seek immediate medical attention. Early recognition and treatment can significantly decrease the risk of severe complications or death. Remember, knowledge is power. Knowing these signs could be your best defense against the life-altering effects of a stroke. Sign number 1. Sudden confusion or trouble understanding. Sudden confusion or trouble understanding simple statements and commands can be a disconcerting and often overlooked sign of a stroke. This symptom, characterized by an abrupt disruption in cognitive functioning, might manifest as difficulty following a casual conversation or an inability to grasp basic instructions that were previously understandable. Such confusion is caused by the sudden interruption of blood flow to parts of the brain that are responsible for cognitive processes and communication. When someone experiences this sudden cognitive shift, it can seem as if they are suddenly disoriented within their surroundings, or unable to process what is being said. The effect is not just limited to verbal communication, it can also impact the ability to read or write. Imagine the brain as a busy network of highways, and suddenly, the most critical roads are blocked off without warning, leading to immediate traffic chaos. Similarly, when a stroke occurs, the neural pathways in the brain that facilitate understanding and responsiveness become obstructed, leading to a noticeable and immediate decline in cognitive abilities. Recognizing this sign is crucial, as it is often subtle and can be mistakenly attributed to fatigue, stress, or even aging. However, unlike these conditions, the onset of confusion related to a stroke is sudden and pronounced. If you notice someone suddenly struggling to comprehend simple dialogue or appearing unusually perplexed by routine tasks, it is essential to consider a stroke as a possible cause and seek immediate medical attention. Quick response to such symptoms can be critical in limiting the damage to the brain and increasing the chances of recovery. Sign number 2, sudden trouble seeing in one or both eyes. Sudden trouble seeing in one or both eyes can be an alarming and often unrecognized sign of a stroke. This symptom may manifest as a sudden blur or blackening of vision, double vision, or even a temporary loss of sight. It is caused by an interruption of blood flow to parts of the brain that are responsible for processing visual information. When experiencing this symptom, individuals might find that objects in their field of view suddenly become fuzzy or split into double images, making it challenging to focus. In some cases, one may experience a complete blackout in one or both eyes, as if a curtain has been pulled over their sight. This can occur without any pain, making it particularly insidious and easy to disregard as mere fatigue or eye strain. However, unlike regular vision issues that develop gradually or are associated with specific eye conditions, stroke-related visual disturbances occur abruptly and without warning. The areas of the brain affected during a stroke can include those that communicate with the nerves and muscles controlling eye movement and visual processing, leading to these sudden visual impairments. It's crucial to recognize that these symptoms are serious and warrant immediate medical attention. Prompt recognition and treatment are essential, as delays can lead to permanent vision loss or further complications associated with the stroke. If you or someone around you suddenly experiences unusual vision problems, it's critical to treat it as a potential stroke symptom and seek emergency medical care to mitigate the risk of lasting damage. Sign number 3, sudden severe headache with no known cause. A sudden severe headache with no known cause is a critical and alarming symptom of a stroke. unlike typical headaches or migraines that have identifiable triggers or develop gradually. This type of headache strikes abruptly and with intense severity. It is often described by those who experience it as the worst headache of their life, occurring without any prior warning or apparent reason. This headache results from the disruption of blood flow in the brain, either due to a blockage, ischemic stroke, or, more commonly in cases involving severe headaches, a burst blood vessel, hemorrhagic stroke. The rapid increase in pressure within the skull from a hemorrhage can lead to an intense headache as the brain reacts to bleeding or swelling. The pain from such a headache can be overwhelming and debilitating, and it might be accompanied by other stroke symptoms such as nausea, vomiting, dizziness, or altered consciousness. Due to its sudden onset and severity, it's a symptom that cannot be ignored. Many people mistake it for a migraine, which can delay critical time-sensitive treatment. Immediate medical attention is vital when this symptom is present. Emergency medical services are equipped to handle such situations with rapid assessments and interventions that can potentially save brain function and life. Recognizing this symptom as a possible sign of a stroke and acting swiftly can significantly influence the outcome, reducing the risk of long-term disability or death. If you or someone near you experiences a sudden severe headache with no known cause, it is essential to treat it as a medical emergency and seek professional care immediately. Sign number 4. Sudden dizziness or loss of balance. Sudden dizziness or loss of balance can be a disorienting and potentially dangerous sign of a stroke, often catching individuals off guard. This symptom typically manifests as an unexpected feeling of unsteadiness or a spinning sensation, which may lead to difficulty standing or walking properly. The affected person might find themselves grabbing onto objects for support or unable to maintain their balance without assistance. This sudden loss of coordination is caused by an interruption in the blood flow to the parts of the brain that regulate spatial orientation and balance, namely the cerebellum or the brainstem. These areas are critical for processing signals from the visual system, the inner ear, and the body's sensory nerves that contribute to maintaining balance and posture. Unlike general lightheadedness or brief moments of imbalance that can be attributed to less serious issues, like dehydration or low blood pressure, stroke-related dizziness is more severe and occurs without a clear cause. It is often accompanied by other neurological deficits, such as difficulty speaking, vision problems, or weakness on one side of the body. Recognizing this symptom as a sign of a stroke and responding quickly is crucial. Sudden dizziness or loss of balance should be treated as a medical emergency, especially when it occurs in conjunction with other typical or atypical stroke symptoms. Immediate medical intervention can significantly improve outcomes by minimizing brain damage and increasing the chances of a successful recovery. If someone experiences these symptoms abruptly and without explanation, it is essential to seek emergency medical care right away. Sign number 5. Sudden nausea or vomiting. Sudden nausea or vomiting can be a lesser-known yet significant indicator of a stroke, especially when it appears abruptly and without a clear cause. This symptom can be particularly deceptive because it is commonly associated with many less severe conditions, such as food poisoning, viral infections, or even routine stomach upset. However, when related to a stroke, sudden nausea or vomiting is caused by an interruption in blood flow to parts of the brain that control the digestive system's reflexes. This disruption can occur when a stroke affects areas like the brainstem or cerebellum, which are responsible for regulating bodily functions such as balance, coordination, and involuntary processes like nausea. The onset of these symptoms in the context of a stroke is typically very sudden and may be accompanied by other neurological signs, such as headache, dizziness, confusion, or altered consciousness. Understanding and recognizing this as a potential stroke symptom is critical, as many might dismiss nausea or vomiting as a minor issue and delay seeking medical attention. It is particularly important to consider it as a stroke warning if it occurs alongside other symptoms that do not usually accompany gastrointestinal issues, such as unilateral weakness, slurred speech, or severe headache. Prompt recognition and response to these symptoms can greatly influence the effectiveness of stroke treatment and the overall prognosis. If sudden nausea or vomiting arises unexpectedly and is paired with any other unusual or neurological symptoms, it should be treated as a medical emergency. Seeking immediate medical intervention can help ensure timely and appropriate care, potentially minimizing the long-term impacts of the stroke. Sign number 6. Brief loss of consciousness or fainting. A brief loss of consciousness or fainting can be a subtle yet serious indication of a stroke. This symptom arises when there is a temporary reduction in blood flow to the brain, affecting its ability to function properly. In the context of a stroke, fainting might not be as dramatic as other symptoms, but it represents a significant disruption in brain activity that needs immediate attention. Strokes that lead to fainting often involve the brainstem or other critical areas that regulate the body's basic functions, including consciousness levels. The interruption in blood supply can cause an abrupt drop in brain function, leading to a sudden and brief loss of consciousness. This might occur in isolation or be accompanied by other stroke symptoms such as weakness on one side of the body, slurred speech, or confusion. Unlike common causes of fainting such as dehydration or a sudden drop in blood pressure, stroke-related fainting is typically sudden and occurs without any preceding warning signs like lightheadedness. It is crucial to recognize this as a potential stroke symptom because it can easily be overlooked or attributed to other, less severe causes. Immediate medical evaluation is essential when someone experiences a brief loss of consciousness, especially if there are no clear triggers or if it is accompanied by other neurological signs. Quick action is vital as it can drastically improve the effectiveness of stroke treatments and reduce the risk of permanent damage or other complications. If fainting occurs suddenly and inexplicably, it should be considered a medical emergency, prompting an urgent call for professional medical help. Sign number 7, sudden hiccups. Sudden, persistent hiccups can be an unusual and often overlooked sign of a stroke, particularly affecting the brain areas that control involuntary actions. This symptom is more commonly observed in strokes that involve the brainstem, where many of the body's reflex actions are regulated, including the reflex that triggers hiccups. Hiccups result from involuntary contractions of the diaphragm, the muscle that separates the chest from the abdomen and plays a crucial role in breathing. These contractions cause a quick intake of breath that is suddenly stopped by the closure of the vocal cords, producing the characteristic hiccup sound. When a stroke disrupts the brain's normal function in areas that manage these reflexes, it can trigger uncontrollable hiccups that start suddenly and may be difficult to stop. Unlike typical hiccups that are benign and usually resolve on their own after a few minutes, stroke-related hiccups are persistent and occur without any obvious reason such as eating too quickly, consuming hot or spicy foods, or drinking carbonated beverages. They may also be accompanied by other neurological deficits such as difficulty swallowing, dizziness, or an altered level of alertness. The sudden onset of persistent hiccups, especially when associated with other unusual symptoms, should be taken seriously and treated as a potential sign of a stroke. Recognizing this symptom as part of a stroke can be challenging due to its rarity and the common nature of hiccups in general. However, if someone experiences sudden, continuous hiccups along with other signs of a stroke, it is crucial to seek immediate medical attention. Early detection and treatment are key to mitigating the effects of the stroke and improving recovery outcomes. Many of the uncommon signs of a stroke are often overlooked because they can be subtle or resemble symptoms of less serious conditions. For instance, sudden severe headaches may be mistaken for migraines, and persistent hiccups could be dismissed as a minor nuisance. Additionally, signs like brief loss of consciousness or sudden dizziness might not immediately raise alarms, as they can occur in various benign situations. This confusion often leads to delays in seeking medical help, which can be critical in the context of a stroke. If you or someone you know experiences any of these unusual symptoms suddenly and without an apparent cause, it is essential to act quickly. Immediate action can make a significant difference. Call emergency services right away, as prompt medical intervention is crucial. Describe all symptoms clearly, including their onset and severity, to aid rapid diagnosis and treatment. Recognizing and responding to these signs promptly can save lives and reduce the risk of long-term disability. Let's quickly recap the uncommon signs of a stroke we discussed. Sudden confusion or trouble understanding, unexpected vision problems in one or both eyes, a severe headache with no known cause, dizziness or loss of balance, sudden nausea or vomiting, brief loss of consciousness, and relentless hiccups. Each of these signs can appear without warning and might not immediately suggest a stroke, making them easy to overlook. I encourage you to share this information with your friends and family. Spreading awareness about these less-known signs of a stroke can potentially save lives and prevent long-term disability. Knowledge is a powerful tool in the fight against stroke. Finally, take action for your health and the well-being of your loved ones. Learn more about stroke prevention and management. Understand the risk factors and discuss them with your healthcare provider. Remember, the faster you recognize and respond to the signs of a stroke, the better the chances are for recovery. Stay informed, stay vigilant, and take care of each other.